Obviously, if healthcare costs skyrocket and we have a lot of unnecessary care and frivolous spending, that's not going to be good for anybody. It's not going to be good for anybody, the patient, the employer who's providing the insurance. So the insurance company is going to want to control the doctor's behavior, and they're going to do that by several methods. They could hire the physician, they could sign him to a contract which he agrees to abide by certain oversight rules and regulations. Often they have to get pre-authorization or have him respond to a medical director of the insurance company if there's any questions. And they can also set certain standards of things that they're going to pay for and not pay for. And they could spell that out. And they can also incentivize the doctor who's managing the patient and saying, if you provide great care, great outcomes, we'll give you extra reimbursement. And if your outcomes are not that great, you might get less. The insurance company is also going to try to negotiate rates and say, well, we have a bunch of other doctors that will accept this reimbursement. And if you don't agree to that rate, we'll use this other doctor group. And so that is their attempt at trying to control the physician.